Hi everybody, Becky with Dental Wellness Center of Maryville. I'm here today to educate you about something that everyone suffers from time to time, and that is bad breath. Everyone has experienced morning breath or eaten something very garlicky or something with onions that makes you feel like you have bad breath for the day. That's not what we are talking about. We're talking about bad breath all day, every day. It's embarrassing for most, but I'm going to give you some information today to help you understand why people get it, how you can avoid it, and how it can be treated. The medical term for chronic bad breath is halitosis. An estimated 25% of Americans suffer from bad breath on a daily basis. It's important to understand that less than 10% of bad breath cases are due to underlying medical conditions. This can be diabetes, reflux, sinusitis, tonsil stones, certain types of cancers, and liver or kidney failure. Dry mouth can also cause bad breath. A lot of people suffer from dry mouth due to daily medications that they take for medical conditions. They do sell over-the-counter products, dry mouth toothpaste and dry mouth rinses to rehydrate and help combat those symptoms. It's a temporary fix, but it can help alleviate some of those symptoms for you. Now we're going to get into more primary causes of bad breath. Both are related to your home care of brushing and flossing. The first cause is areas of your mouth that your dental hygiene at home miss, which allows food and plaque to remain on or in between the teeth. This attracts bacteria that produces bad smelling chemicals, technically called volatile sulfa compounds, which includes hydrogen sulfide, and that may remind you of a rotten egg smell. To combat this, make sure you are brushing and flossing daily. Thorough brushing with a soft bristle toothbrush in a circular motion 2 to 3 times a day, and flossing 1 to 2 times a day, especially before bedtime. When flossing, you want to think about shining a shoe. You want to pop your floss down, run it back and forth, up and down, and gently pull towards the tooth in front and the tooth in back to scrub those surfaces really well. This will also get under the gum line slightly, and it will help get into those little areas where food and plaque like to hide. Very important, 6-month checkups with your dentist and your hygienist for your oral exam and your cleaning will also help combat those little areas that your brush and floss cannot get. Second, more severe cause is periodontal disease. If food and plaque are not properly cleaned daily, it sits on your gums and teeth, which allows gum irritation. If you notice when you're brushing and flossing that your gums are bleeding or sore, that is a sign that your gums are irritated and you may have periodontal disease. Food and plaque sitting on the gum line also leads to gaps and pocketing between the teeth, which allows plaque and food particle to collect below the gum line in areas that your brush and floss no longer can reach. This leads to bad breath because now you have periodontal disease. You will have bad breath daily. Over-the-counter products will only mask the deeper issue. You cannot treat this yourself at home, but there is treatment. If you think you are experiencing periodontal disease, you will need to be evaluated by a dentist and a hygienist. They will do a thorough exam, which includes checking your tongue, your tonsils, an oral cancer screening, and a gum exam. The gum exam will tell whether you have perio disease. If so, your doctor and the hygienist will recommend gum infection therapy. This treatment removes particles from under the gum line, which causes bad breath. You will then go on to a more frequent cleaning schedule to keep this from returning. Along with recommendations of extra home care, this treatment will significantly help or eliminate your bad breath. Other things you can do to combat daily bad breath are non-alcohol mouthwashes, brushing your tongue if you can tolerate it, but getting to the source of the problem is key. So to recap, good home care is the key to battling bad breath, whether it's your daily routine of brushing and flossing, or you need some guidance and treatment from your dentist and your hygienist first to eliminate the source. You do not have to live with the embarrassment of bad breath. There is treatment. I hope this information was helpful and educational. We are here to help you with any of your dental needs, including what I have talked about today. Thank you for watching. Take care.